When I was young, I wanted to make a difference when I grew up. I wanted to be something that mattered, someone that could really make a difference. It wasn't until much later, well into adulthood actually, that I realized I wanted to be a paramedic. What does it take to become a paramedic? What qualifications are required to be the guy or girl riding in the ambulance and taking care of sick or injured people? Today, we will learn about the requirements, training, skill set, and dedication it takes to become a paramedic. Let's begin. With no training at all, where does one start to begin the transition from everyday civilian to life-saving paramedic? Paramedicine has come a long way, and it is often misunderstood by the public. I assure you, paramedics do much more than just give people a ride to the hospital. When EMS started back in the 1970s, most paramedics were employed in the police department and were chosen or signed up to be emergency medical responders. The first paramedic classes were taught by doctors, and the scope of practice was minimal and fairly simple. Do what you can. Nowadays, things are much different. We now have national standards set in place for minimal training requirements, including skills verification and very extensive patient contacts. EMS is fairly new in the realm of public safety, but it is a cornerstone to the public safety net. Calling 911 will connect you to a dispatch center with trained individuals to answer any call of an emergency. Seconds into the call, the dispatcher knows who to send and what information to give them. This activates the EMS unit, and you can feel guaranteed that someone is coming to the rescue. But before that call is ever made, how did this person become a paramedic? The answer is dedication. It's no easy task to become a nationally registered paramedic. The only pre-requirement for starting training to be a medic is to already be an EMT. EMT training is offered in many different settings through fire departments, private organizations, and colleges. EMT training alone takes anywhere from 3 to 6 months and sometimes longer depending on the structure of the class, and is strenuous, taxing, and full of new information. Students devour large textbooks discussing basic anatomy and physiology, medical and trauma training, obstetric emergencies, pediatric emergencies, CPR and resuscitation training, special needs populations emergencies, and operations material. Students also have to learn etiquette, learn to remain calm under extreme pressure, and learn critical thinking abilities to make the right decisions quickly. If the EMT students work very hard, pass the didactic portion of the class, and are skilled in their psychomotor evaluations, they are granted the opportunity to test for the National Registry of Emergency Medical Technicians in a strategic test that gets more difficult as you do better. If the student passes this test, they are granted the license to practice within their scope under the license of a state-certified physician. Once someone has passed all the requirements for becoming an EMT, they have options. Now this student can work in EMS in many different types of work. Private services, who do interfacility transports between hospitals and nursing facilities. Municipal services that respond to 911 calls, or other private options like warehouse EMTs. It's recommended that an EMT gets a couple of years of service before attending paramedic school, but is not required. After gaining an EMT certification, an aspiring paramedic can apply to a paramedic school that is accredited and either gain an associate's degree in paramedicine or just the paramedic certification. Once accepted to paramedic school, the student will be tested on his or her knowledge of basic EMT skills. A paramedic is the highest level of care in emergency medical services, equivalent to an RN in most cases on the streets in the pre-hospital environment. The paramedic is responsible for everything to do with patient care in the field. In essence, everything is their fault or to their credit. Because of this, a paramedic must be extremely confident in his or her skills and knowledge base. It has been said that what paramedic school teaches people is exactly what they didn't know they didn't know. And that is very true. What are the differences between paramedic level training and EMT training? Paramedics are educated to a much higher standard on etiology, physiology, pharmacology, anatomy, biology, resuscitation, cardiology, special populations, as well as scene command and decision making. But that's just the start of it. The information overload that occurred at EMT school is exponential in paramedic school. Not only do you learn what to do in certain situations, but you learn why and how it works. Also, you learn invasive maneuvers and techniques that can cause serious harm to the patient if not performed correctly or at the correct time. Paramedics perform IVs and IOs, can use electricity for therapeutic treatments, interpret ECGs, administer dangerous medications, intubate the airway, and override any call made by the EMT on scene. Paramedics are the top level of medical care in the field. Not only does a paramedic need to complete and pass all didactic portions of the paramedic class, but they have to be evaluated on their skills in the hospital clinical environment. Paramedic students are required to have an extensive number of inter-patient contacts of many different types. A paramedic student must demonstrate competence with all skills and all types of patients in the ER and other departments of the hospital. Once they have met these qualifications and been certified in certain resuscitative classes such as the AHAs, ACLS, and PALS classes, a paramedic student can now begin the final stages of their training. Ride time with the EMS service, where they act as a paramedic on an ambulance under the supervision of a seasoned paramedic. Ride time again requires many patient contacts and proficiency in all skills and population types. Depending on the student's motivation and run volume of the service the student chooses to ride with, this can be a long process, especially when having to schedule around working and still attending class. After the didactic portion of the class, the hospital internships, and the ride time, a paramedic student is then tested with psychomotor evaluation portion of the NREMT exam, where they are graded on a pass or fail scale with all the paramedic skills they've been trained on. Once they have passed all these skills, a paramedic student is granted the ability to take the dreaded NREMTP computer-based certification test. All of the training has led up to this. 2+ years of school with hours and hours of exhausting effort. Now this test decides if they are able to work the streets in their desired role as paramedics. If they pass, it was all worth it. The requirements for becoming a paramedic are great. You must complete hours and hours of book-style educational tests, perform with competence and accuracy many advanced skills, know the protocols for all types of situations, understand the complexity of the human body and disease processes, be distinguished in pharmacology and cardiology, and be a leader. You have to be dedicated to public service to get all this done. Most students say they have no social life during paramedic school and give up time with their own families and friends in most cases. The journey is a long, hard process, but if you pass all the testing and make a difference to one patient that needed your skills and knowledge, it's all worth it. Hopefully now you understand more thoroughly what it takes to be the guy or girl in the ambulance. Hopefully you understand the dedication it takes to get there. I'm almost finished with my journey through paramedic school. I've made it through the didactic portion, I've finished my hospital clinical internships, and I've completed my ride time acting as a paramedic. Next up for me is the psychomotor skills test, followed by the EMT certification exam. It will be worth it.